Minister Terrence Deyalsingh is thanking nurses for their commitment, noting that between 90 and 95% of nurses showed up for work on Friday. This, he says, comes despite a call from the Trinidad and Tobago Registered Nurses Association for nurses to engage in a 24-hour day of prayer. The minister assures that they will continue to engage nursing personnel to solve and address their valid concerns.
We will treat with your issues respectfully, and the issues have largely been solved at the ERHA and the Southwest RHA, and we continue to treat with them. Some of the issues are before the Chief Personnel Officer, and I want to thank that 90 to 95% who have come out.
Mr. Deyalsingh says, though contingency plans were in place to ensure patients were not affected.
Our nursing personnel who have come out in almost normal numbers. Those areas where we have a couple shortfalls, the RHAs, and Dr. Moore can speak about that, they have engaged their contingency plans, and the feedback is absolutely no patient care has been compromised.
Meanwhile, President of the Trinidad and Tobago Registered Nurses Association, Eddie Stewart, said today's action was one of the best to date. Speaking via social media, Mr. Stewart said some regional health authorities experienced between 20% and 90% absenteeism.
We were aiming, when we conceptualized this activity, was for between 20 to 25%. And I think we have far exceeded our expectations. Certain wards, it was a total ghost town, and they had to be pulling wards, asking nurses to come out on pool and all of those things. So those nurses who refuse to come out on pool, we also want to thank you tremendously.
The TTRNA president said the intent is not for patient lives to be lost or affected, and complimented staff and management who worked together to ensure wards were maintained with skeletal staff. But he warned that if their issues are not addressed by the finance minister during the budget presentation on Monday, further action is likely.
If you try to dismiss what happened today, if you try to dismiss nurses and midwifery personnel, if you try to dismiss the activities of the Trinidad and Tobago Registered Nurses Association, then you are forcing us to take more action.
In Tobago, Interim Chief Executive Officer of the Tobago Regional Health Authority, Wesley Orr, confirmed a number of nurses did not turn up for work. However, he explained that there was sufficient nursing staff on hand for services to be delivered efficiently.